Welcome to the Eastman Dental Podcast, where we hope to inspire, motivate, and provide education from our guests' experience.
And this week, I'm joined by Denny Wang, who's recently completed his MS Cons program at the Eastman, and Basmah Al-Otaibi, who is a pediatric postgraduate trainee here as well.
Don't limit yourself and dream big. Funny story is when I graduated from my bachelor, I swear to myself I would never do a specialist training. But now you see, I came here and I never imagined myself to study abroad. So you never know when life will bring you to.
Have patience, okay? Believe in yourself, because sometimes you're going to doubt yourself and it's okay.
With your host, Josh Hudson.
This is the first episode of the series where we will look at postgraduate training courses. And there are a range of postgraduate training options, from weekend courses to MSCs to either NHS or privately funded specialty training programs, right through to training to become a consultant. So first of all, Basmah, tell us briefly about yourself and how you've got to this point in your career.
Hello, everybody. So I've done my undergrad studies at the University of Leeds from 2012 to 2017. Once I graduated, I had to go back home to my home country, which is in Kuwait. I became a general dentist there, worked for 3 years, and then decided it's time for me to become a specialist. So I looked for other programs, especially in the UK, because I love the UK. And London has always been the choice for me. So I've applied everywhere and got accepted almost everywhere. But UCL has been my number one choice. I met the consultants prior to accepting the offer, and I've absolutely enjoyed everyone's company. And now I'm here. I'm currently in my second year in residency and training and enjoying every minute of it, honestly.
Perfect. Sounds great. So I'm intrigued. You decided to do your undergraduate training in the UK, and I guess you could have gone anywhere. So what made you choose to come here to do it?
So at the beginning, I honestly had no idea what to do. Once I graduated from high school, I was thinking, is it time? Is it meant to be to go abroad? My friend actually studied at the University of Leeds. She's 1 year older than me and told me, you should come to Leeds. And I was like, where is Leeds? And she told me it's in the UK. And I never thought of that. So I never heard of the concept of scholarships or sponsorships and all of that. So in Kuwait, you have the opportunity to apply and just try your luck. So I was one of the 11 students who got accepted for a scholarship to study dentistry in the United Kingdom, and I was one of 2,500 students who applied. So I was really lucky to get accepted. And once I got accepted, I managed to do the foundation year at the University of Leeds because I was an international, and it was a must to do that. And after that, I managed to get straight A's. So I was lucky. I studied really hard, and I passed my interview and got accepted into dentistry. And I enjoyed those 5 years very, very much.
That's great. And out of interest, you mentioned that kind of rigorous process that you had to go through to be able to get sponsorship to study here. Out of interest, how did they get from those 2,500 applicants down to 11? What was the process?
So the process is you choose your options. So you have 7 you rank which majors you want in what countries, because the 2,500 can apply anywhere in the world and in many different specialities or majors. So it could be engineering, medicine, it could be the UK, it could be Canada. So I think I was lucky because I've put only one option, which was dentistry, the UK. I think they felt sorry for me because people had 7 options and I only had one, and I only picked one because to me it was either the UK, dentistry specifically, or I'd rather stay back home and do dentistry back home. And I was lucky. I honestly was really lucky because I didn't get the highest grades. If I'm being honest, I did not get the highest grades back home, and it was very competitive. So I was just lucky that whoever got higher grades than me did not put dentistry as their number one option. So it's just a matter of luck. It was meant to be, I guess, to go to Leeds, and now here in UCL.
And now you're back again. So Denny, what's your backstory? How have you ended up where you are now?
Well, so I graduated in 2015 from the University of Hong Kong, where I came from. And then after graduation, I was a junior resident back in the teaching hospital in the University of Hong Kong in the prosthodontic department. And that's where I developed my interest in prosthodontics. And then I worked 3 years in general practice, and then it comes to a time that I decided to have a change. So I was researching about master programs all around the world, and I discovered this 1 year intensive MSc program in Eastman, and I applied for it. And so very luckily I got here, and then I completed the master in 2020 during the COVID time. And then I stayed now in the Eastman as a locum specialty registrar in restorative dentistry to further my training.
Okay.
Yeah.
So Basmah obviously had the kind of connection with the UK from the undergrad side of things, but again, you could have gone anywhere. So what was it particularly that brought you here to the UK and then to the Eastman specifically?
Wow, very interesting story. So to be honest, I haven't been to London or UK before I make up the decision. Yeah, so it was more about and I have never imagined myself to study abroad originally, but working 4 years in dentistry, it just made me to a point that I'm starting to thinking my future. Is either say some of my friends, they may be already planning to open their own clinic. Some of them are doing a specialty training back in Hong Kong. And then to me, I feel like I just want to change. Yeah, I don't know where I will go to. And then so that's why I start to research about the program. Just one day I randomly bump into a senior dentist who did the same program. So I have a chat with him, and I find this program seems to suit me, because I feel like I may not be able to do a specialty training because of all the time commitment and financial commitment as well. But I think a 1 year master will really suit my future career. And I want to do it abroad because I don't want to stay in my home country forever before I decide to, establish my clinic there potentially. So I just want to see the world. So that's why I chose this program.
Perfect.
Yeah.
And Basmah, you came here to do your undergraduate degree, you went back, and then what was it that made you decide to specialize generally, and what made you specifically decide to look at pediatrics?
So when I went back to Kuwait, we do an internship here. And that internship here, you go into all the specialities in dentistry. You get to work as a specialist, obviously under supervision, and you get to explore all the options and see exactly where you fit in. Some people decide they want to be a general dentist forever. That's absolutely fine. For me, despite the fact that pediatrics is a very difficult and challenging specialty, for me, I enjoyed it the most. I saw how it is kind of challenging, but yet very rewarding, because I'm changing these kids, their life. I don't want the dental visit to be so traumatizing. And a lot of them did enjoy my company, surprising, despite the fact that I was actually kind of drilling and filling and doing all of these things. So it was very rewarding for me, and I decided this is what I wanted to do. So I talked to all of the specialists then, and most of them graduated from Leeds. Personally, I love Leeds. Thank you, University of Leeds, for all of the years, but I did not want to go back. I felt like I was ready, exactly the same as you, kind of felt the same. I didn't want to stay the same place forever. And I went to 2 extra years as a general dentist just to get that bit of more experience. And then I applied because back in Kuwait, there is this issue where if you're a general dentist, you are very limited to what you do. I know here you can do a lot of things. You can do endo, you can do crowns and all of that. Back in Kuwait, as a general dentist, you're actually not allowed to do that. So for me, I don't want to be that limited. No offense to my country, I love Kuwait as well, but it was very limited. I really wanted to explore more of my clinical skills. So coming here and actually specializing will allow me to go further down the line in terms of I will be doing general anesthetics. I will be exploring more in terms of inhalation sedation or IV sedation. So I will be ready for that kind of treatments.
Okay, so it works sort of on a referral basis then, I guess, in Kuwait. Somebody sees the patient and then sort of sends them off to the specialist from there.
I've done a lot of referrals, like those 3 years, a lot. You keep seeing these patients and I'm like, I can do this, but I'm not allowed to do this, so I have to refer to a specialist.
That makes sense, I can understand. So Denny, you obviously decided that you wanted to do some further training. And then you decided you wanted to do it in the UK, and then specifically you decided you wanted to do it at the Eastman. So what was those next steps? What was that application process? How did you go about getting onto the program, and how did you find that?
So for the application process for the MSc, it's quite a standard procedure basically. You need 2 references, which is, I think, the best one to ask for is someone from your dental school, like someone with some academic backgrounds. And then you just go online, apply for it, and wait for the interview and behave yourself in the interview, really. And some tips about the interview is, I would say, those questions are really like some expected question that you will expect from a postgraduate program interview, but just be prepared yourself about get to know about the program. So the best thing to prepare is really try to ask someone who have done the program before and know what is the commitment to the program. I think that is probably the interviewers want to know that you are really prepared for the program, because say for my program, it's a really 1 year intensive training in both clinical aspect and also in academic aspect as well. So you got lectures and you got research as well. So you complete everything in 1 year. So it's really intensive. So I think the interviewer really want you to be prepared about it. And then otherwise, I think it's quite a standard procedure for the application.
So Denny, you mentioned that there was kind of the standard questions that they asked you as part of that interview process. What kind of things were they asking you? Were they asking you about your experience, academics? You mentioned about why you want to do the program and the commitment, but can you give a bit more insight into the kind of questions that were asked?
Well, so to my memory, the interview lasts for about 20 to 30 minutes. So it starts with like, why do I want to apply for this program? I think just be general about the answer, really. Yeah. And then they asked me about my previous like training experience and what I did in my daily practices. And then also they really asked me like, can you tell me about this program? Like, what do you know about it? And so, and do I know anyone from the program? Did we like speak before I apply for this program? So, and they also try to reassure me like this is a really, really intensive program. So are you prepared to commit to it in terms of time and also like financial commitment as well? So not surprised, but you really need to prepare for it, I would say.
Okay.
Yeah.
And Basmah, what was your application process? Was it similar to that?
Quite similar. For me, it was, again, an online application. I knew people who graduated from the pediatric program at Eastman, so I asked them all the questions before applying. I knew exactly that this is what I wanted, so I went online and I actually applied on the last day where the application was gonna close. And it was a very easy process. And the application doesn't require that much. So for me, it was like the CV, personal statement, all of that. Luckily, I had all of those prepared. My recommendation is get someone to read those for you. Don't just think they are perfect and apply. Let someone read them, proofread them, and just apply. And for me, I had to do my IELTS exam as well. Despite the fact I graduated from the University of Leeds, I still did it just in case. And all you needed to do is fill in your personal information, submit, and wait for that email. I was lucky I didn't have to wait that long to hear back. And it's very important, again, to prepare for the interview. I did something that I actually visited the Eastman prior to hearing back from them. Because some people say that it's good to kind of make sure that they understand that you are really committed and you really are interested. So I dropped an email to a director and I was like, hi, can I come for a tour, please? I went in and I met everyone. I did that for many universities, not only the Eastman, because I came in to London for a visit. And
did that help, do you think? Do you think that helped the process?
I think my personality showed more rather than just on paper.
Yeah.
Because they saw how interested I am, and I was really keen to start. Like, yes, let's do this. I want this. And I noticed how they were like, "That's a very good thing that you came." And I think I was lucky.
Yeah, it's a bit more casual as well, I guess.
I do have to apologize to the directors of all the programs, so this might cause them a lot of meetings and tours. I am not recommending. I'm just saying it worked for me, not guaranteed.
Yeah. So did you have an interview process after that?
Yes, I did. A very quick interview.
Okay.
Very simple questions. It's basically about my experience. I made sure I had enough experience because you can see that all of the programs, especially for the D-Dent one, you have to have 2 years of experience. So I made sure that I had the enough experience to do that. And basic questions. I do have to recommend that you need to learn a little bit more about the speciality you're interested in, because some of them asked me if I had read anything interesting lately in pediatric dentistry. And guess what? I did not. I did not read anything. And because I was a general dentist, I was interested in pediatrics, but not to the point where I was like reading. So I was honest at this point. I was like, I do have to apologize. I've read something more into general dentistry rather than pediatric dentistry. And they asked me what I read about general dentistry. I put myself in that situation, honestly. So I had to think of like a paper I read recently. Luckily, I read sometimes. So that worked in my favor. But be prepared. That's all I have to say.
Okay, no, that sounds great. So you were both obviously successful in the application process and you got into the program. Denny, yours is slightly different from full specialist training in that it was the shorter MSc. I was just wondering if you could give us sort of a summary of what's involved in the MSc program and what people applying for similar kind of programs should expect.
Well, so in title is a Master of Science in Conservative Dentistry, but basically it is training mainly in fixed prosthodontics. And it also got the implant dentistry elements and a bit of the operative dentistry and endodontic training as well. So I would say it's more like a really with a main focus is on fixed prosthodontics. Basically, in this master course, you're having all the seminars and training together with the 3-year prosthodontics specialty trainees.
Okay, so is it the same first year then, pretty much, in terms of the academics?
The same, but we don't have the removable elements, so it allows you a little bit more time to do some like endodontic training and some training in operative dentistry as well. And then so this is the academic part, and you have the lectures together, and you also need to complete one dissertation in 1 year. But apart from that, I think the best thing is you also got the clinical elements, which is you see patients, you do patients in Eastman, and also you are required to do most of your laboratory work, which is, I think, is very essential and very critical for prosthodontic training, because it makes you understand how a prosthesis is made from, and it just makes you understand the whole process, and it's about to get the control in your hand, really. And so I would say, if I need to compare this program to many other like part-time program, I think this is probably the best element, is because you got the academic part, and you also got a clinical and laboratory training part.
Yeah.
So this is quite, I would say, it complete the whole training in prosthodontics. Yeah.
So with the academic element, is that like almost like going back to university then? Is that going to lectures, seminars? Is that quite tutor-led, as in being taught things? Or is it more, here's some things we want you to learn about, go away and do it yourself? Or how does the academic part, is it more self-directed or is it more taught?
I would say it's really a bit of both. So weekly, we will have about 2 to 3 seminars.
Okay.
So basically, before the seminar, you'll be given a reading list. There's quite a lot of classic literatures that you need to prepare for. And then in the seminar, the supervisor will lead, try to facilitate this discussion. Yeah. And but I would say it's more about like you do your self-directed learning before the seminar, and then when it's come to the seminar, everyone try to put together the knowledge, and then you summarize what you learn from there. Yeah. And so this is the academic part. And then when it comes to clinical parts, basically you'll be assigned the cases and you will have a chance to discuss cases with your supervisors. But I think there's also quite a lot of background reading and preparation that you do before you present your cases to your supervisor. Or sometimes weekly we also have a case discussion sections with all the trainees in the department, so everyone gets a chance to present their cases, and with that you also need to prepare yourself to support your treatment rationale with scientific evidence.
Okay. And then Basmah, obviously your course is slightly different. It's a longer course with the D-Dent, so it's 3 years. Is it the same kind of setup in terms of academic teaching, or how is that 3 years broken up as part of your course?
So it's not as intense as yours, that's for sure. For us, it's, for example, year 1, very basic information that as a pediatric resident you need to know. So we had a lot of like treatment planning and the basic diseases, caries, trauma, all of that. The lectures are actually lecture casts, which are pre-recorded and available on Moodle. So we take the time, our own time, to study those material. And then once we study them, we have seminars every other week with different consultants. And once we attend those seminars, they're very Viva based, so they give us some clinical pictures, and we have to kind of decide on the treatment plan, diagnosis, and all of that. And it's very, very good because we prepare for the MPEDS exam, which we'll definitely need to do in our 3rd year. Second year is more intense. I am starting my 2nd year right now. It is overwhelming because it gets a little bit more advanced. And there's a lot of more like anomalies and very specific syndromes and genes that you need to know. And I'm wrapping my head around it, so we're just trying to at this point. 3rd year is basically the year where you're going to be doing your MPEDS, and I forgot to mention that we start our research from year 1. So you have to do that throughout those 3 years to hopefully submit it within the 3rd year. There's a lot of bits and pieces we do, like audit, for example, and presentations here and there. But it is a very well-rounded program, and I feel like I'm really lucky to be here because I feel confident. If you ask me 2 years ago if I would be able to diagnose, if I would be able to kind of treat or do anything like I'm doing right now, I'm very, very confident now in my abilities, and I'm halfway through. I'm not even done, so I'm very looking forward to.
That's good. And then, so you mentioned there the research. So that's a big element, I would imagine. And then, do you have exams at the end or throughout the years, or coursework, or how does that work? I forgot about all of that. I just deleted all of that. So exams, we have 2 types of exams. We have a written exam, which is the end of 1st year and end of 2nd year. Written exams, it was really long. 1st year, 1 day, 4 exams. Why do they do that? Actually, I loved that concept. At the beginning, when I saw it on my timetable, I was like, why? Why 4 of them at the same time? And then once the day was over, I was like, thank God I have nothing tomorrow. Yeah. So it is a plus because all 4 exams were very similar to each other, and
it was basically just one long exam, if you think about it. Exams were, the written exam was very well done. For me, I have difficulties with MCQs. I don't know if anyone struggle. No, just me. That's fine. So MCQs, I don't like to choose. So the good thing is it's a lot of SAQs questions. So a lot of writing. And as you can tell, I like to talk as well, right? So I enjoyed that very much. And then we have a Viva exam where you have to submit your cases. So in regards to cases, in first year, you have to submit 3 caries cases. So anything as simple as placing crowns or as complex as multiple restorations. And in second year, what we have is to submit 9 cases. It sounds a lot, but it's absolutely fine. So you have to submit 3 cases trauma, 3 cases anomalies, and 3 cases medically compromised. I'm struggling a little bit with the medically compromised because we don't see that often, which is good, but we need them to submit the cases. But that's what I'm planning on doing at the end of this year, to do 9 cases. And it's basically doing a kind of case report thing, and you submit it online, and then you have a Viva with 2 of your consultants and an external examiner. They said they're going to change the kind of the way they examine the Viva, so stay tuned. I'll let you know if you ever decide to come to pediatric dentistry.
So yes, there's a lot of elements there. Denny, is that similar? How were you assessed throughout that year on top of everything else that you had to do?
Well, so a few things to assess. So in terms of the clinical elements, so throughout the year, there will be like 6 to 7 like clinical skills assessments. So you book your patients, you do a specific procedure, say it could be impression taking, jaw registration to like on-nail preparation. And then in that session, when you will be assessed about your skills on the particular procedure and the outcome and your ability to evaluate your work. Yeah. And then in terms of academic assessment, so say in our program, we have like 3 big modules. Like one is on like a multidisciplinary study. So you will be tested on perio, endo, and prosthodontic concepts on paper. So you will be required to write 2 essays. And then you also got a Viva on basically different disciplines as well, which I think it is really, really challenging, but it is quite a fun assessment to do because when you can really present yourself and summarize yourself verbally, I think you really learn something really. And lastly, you also got like an unseen case Viva. So in 30 minutes time, you need to do all the treatment planning and then present your case and discuss your treatment rationale to the assessors. So this is about, and apart from this, you will also need to submit your research, which is a dissertation. So it is also really a big part of the program. You will probably work your head in it in the last 2 or 3 months of the program.
Denny, I'm interested. So you've got to treat these cases clinically, you've got to prepare for these seminars, you've got all these assessments, you've got to do your own lab work. What's the work-life balance if you're doing this kind of program? Are you fully committed? Have you got nothing else but that program for that year? Or how did that side of things work?
Well, the balance is really not balanced.
Okay, there's no balance.
Well, it depends on how much you want from it, I would say. Yeah, I would say like, because also like when we come to this program, some colleagues, they relatively have more experience. Some are more like fresh graduate or fresher in terms of experience. So some of them, like say, let's see the outcome. Like some of them, when they finish the program, they may be able to finish 1 or 2 full mouth rehabilitation cases. But some of us may more focus of some to develop some like more basic skills, or say like restoring single implants, or do I feel multiple restorations. So it really depends on what you want to achieve in the program. And from that, I would say it will dictate the time that you put into the program as well. Yeah, but I would say on average, really, like you spend your daytime in seminars, clinics, and then some or most of your nighttime in the laboratory. And then, for me, I also try to get a bit of the London life experience during the weekend, just hang out with friends. So you also need it anyway. So, but you will find a way out, I would say. Yeah, because like in Eastman, I think you will really meet different people, and some like-minded people. You can work together and you can also play together, really. Yeah.
Basmah, what about your course? Do you have a good work-life balance? It doesn't sound quite as intense as Denny's experience.
Definitely not as intense. I enjoy life. I prioritize my social life, sorry, to the Eastman if they are offended, but social life for me is very important. I can be out and about 24/7 if possible. But for us, it's a little bit different. As you know, today is my day off. So we do have some time off. Usually Fridays, if there is no seminar, it's the day off. Obviously, I should be doing something in regards to my research or study some of those lectures online. And for me, it's very important to time manage, okay? I might not be doing it perfectly, but it's my advice to you. Please manage your time well. That's the most important thing. If you manage time, you're absolutely fine. You're going to be able to enjoy your London life. I hope you did a little bit. No?
I did.
That's the most important
because to me, one of my reasons coming here is also to enjoy some time abroad, right? So I still like get some time to do. Say I really like musical, so I was doing some like musical courses alongside. So. Which is really nice. So I would say you can still get some bit of life, really.
A bit of life.
And can I just add something? And now I think because now Eastman have moved to a new hospital, new setting. So I think now we don't really have the nighttime laboratory sections now. So you need to be out of the hospital after I think like 5 or 6 p.m. So you will get your life, I would say.
Okay, so there's a bit more of a life now. So both of you mentioned that advice for people thinking about doing these kind of courses, number one is to have that sort of balance, work-life balance. Do you have any other advice for anybody that's considering either of your courses or any other postgraduate program for that matter? Have
patience, okay? Believe in yourself, because sometimes you're going to doubt yourself and it's okay. Control the anxiety. I think I'm giving myself that advice because sometimes I struggle with anxiety, unfortunately. Personally, I like to have everything done perfectly, and it's okay not to have everything done perfectly. It's a matter of you learn from your mistakes and you're gonna develop and become better. Because every time I do the slightest, that filling is not perfect, I could have done that just a little bit perfect. Don't over criticize yourself. If you've done something that you feel you could have improved on, think, why did I do that? What could I have done better? For me, that's what I'm changing my mentality from, I did something wrong. The filling is the worst filling to, okay, now I learned from that. How can I do it better? I think that's the most important thing.
I think that's really important. And I guess when you're doing programs like this, you get so narrowed down into that specific element that you're studying, then I can see you could easily become overcritical. Denny, have you got any advice for anybody that's thinking about doing postgraduate training?
I would say also about like really don't limit yourself and dream big. I mean, funny story is when I graduated from my bachelor, I swear to myself, I would never do a specialist training. But now you see, I came here and I never imagined myself to study abroad. So you never know like when life will bring you to. Say if someone is really considering a postgraduate training, I would say don't limit yourself, try to plan for it. And like in my time, I thought I wouldn't be doing a specialist training because I thought like financially I may not be able to afford it, and in terms of time commitment I don't see myself, especially like in Hong Kong, if I want to be a specialist, it takes 6 years for the whole pathway, so I don't see myself can do such a time commitment by then. But now when I started here, I really feel like I want to learn more, I want to go for the whole pathway, and I'm also exploring the potential way of doing it, really. So I would say if someone really want to do it, try to dream big, talk to different people, and then try to plan for it, and you will always find a way when you want to do something.
I think that's good. So what's next for you then? So you mentioned about sort of fully going down that specialty training pathway. Is that on the cards? Is that something you're considering, or where are you looking going forward?
Well, for myself, yes, I'm trying to explore my way to have the training.
Mm-hmm.
Yeah, it may be slightly complicated for me because I did my 1 year training or 1 year master already, but to specialize, say in this country, it will may take like 3 year full-time master. I'm trying to see if there's any alternative pathway that I can do it. I'm still talking with different like senior people to see how I may possibly achieve it. But even if not, I would say I will still further my training in the hospital, and hopefully later to myself, I really like kind of mixed hospital and private practice. That will be my end goal, I would say. So I may be able to do treatment in the hospital and also get some experience in teaching, which I really enjoy it. And this will be my future plan, really.
Sounds good. Basmah, I presume because you've been sponsored, you're going to have to go back to Kuwait and give something back to the government. So how does that work? What have you got to do when you get back home?
Kuwait is waiting for me. They are waiting. Like, come on, graduate. So for us, every year, the Kuwaiti government sponsors 50 dentists to go abroad. That's the limit. And I was lucky enough to be one of those 50 last year. So for us, even when I was an undergrad in the University of Leeds, they expected me to come and work for the Ministry of Health in Kuwait, which I did. And now basically what they're asking for is to work for the Ministry of Health equivalent to the years they sponsored you for. That's the minimum. If you do that, you're free to go. You can do whatever you want. You can leave the Ministry of Health and work in private. For me personally, I feel like I want to stay in the Ministry of Health for the long run, and I would like to kind of progress into becoming a consultant eventually down the line, hopefully. And it's quite simple. Kuwait is sponsoring me to kind of, they're investing in me to be able to go back and become one of the specialists, hopefully. But they do require the MPEDS exam.
Pass MPEDS, number one, and then go back to Kuwait.
Yes.
And progress through the system there to a consultant potentially. Yeah,
hopefully. And maybe come back here. Fellowship? Anyone would offer?
So finally, we are asking everybody the same last two questions. So the first one is to describe 3 things that you enjoy about your role. So in terms of your postgraduate training, what 3 things would you say you enjoy about it particularly?
So as for me, I would say the first thing is I really enjoyed meeting many more like-minded people, my trainees and also the supervisor. I think in a hospital or in an academic environment, you really meet a lot of like dedicated and smart people who is working in the field, and you just really enjoy every like cultural exchange or discussing cases with them. You really learn a lot from them. So I think that's the best thing that I gained from the program. Second thing is to have a postgraduate training. I think it's also about like you can really try out different things. Say, especially in prosthodontics, for one single case, you may have different ways of doing it. You can use different materials, you can use different techniques of doing it. So in a hospital setting, it allows you to try things out, which I really like, and you will learn to know what works best in your hand. Yeah. And thirdly is I think it's also about the time from work. So I mean, it's an intensive training, but you don't have a stress from work, so you also get to have some time really to do my, like as for me, I have some time off to do my interests, which is really good for me. So yeah,
that's great. Basmah, do you have anything to add to that?
For me, I agree 100%. Definitely the same. For me, I'm enjoying a lot the research aspect of things. I've enjoyed it when I was undergrad, and I'm enjoying it here very, very much. It's a very nice way to explore all of that field. Another thing is I'm enjoying kind of thinking like the consultants, because everyone has different treatment plans, and you kind of explore their way of thinking, and then going back to like the evidence-based and what you should do. I think I don't think of the evidence-based as much previously as I do right now, and I want to keep going as much as I can. The third thing might not be related to the Eastman. It might be a personality thing, but I enjoy being goofy with the kids. I enjoy playing around with them very much, and I appreciate that I can do that on a daily basis, and they allow me to do it as much as I want. And everyone noticed how kind of playful, and if you come to the pediatric department, you will definitely see me dancing around with someone. Definitely. So I enjoy kind of that aspect of it a lot.
And then the final question. So having gone through your journey and got to the point that you're both at now, if you were going to go back in time and give your younger self some advice, what advice would you give? Oh my God.
I was going to say quit dentistry. I'm joking, obviously. I'm still here. Believe in yourself. I've doubted myself in every step in my way, and it was so unnecessary. I seem like I'm very confident, but deep down I'm really not confident, even though everyone keeps saying, you're so confident, and it shows. It's just an act. So I do beg, and I wish my future self is listening right now. Believe in yourself. You're doing a great job. You're living the dream. Just enjoy it. So hopefully one version of me is listening.
That's great. That's great advice for everybody, I think. Your younger self, older self, and everybody else that's listening as well. Denny, what advice would you give to your younger self?
Well, this is gonna be sentimental. Yeah, as I previously said, I would say really to dream big, because it'd be similar to Basmah. So I didn't really believe in myself that I can make it to London or to study or to do my specialist training by then. But really, if I can have a chance to do it again, I would say I may rather do it earlier than later. And surely there will be some way of doing it. So really believe in yourself and just work the way out. Like don't limit yourself by any factor. Say if you don't have enough money, then work harder, a bit more time on working, or talk to people and see how they make this way possible. Really, yeah.
Perfect. So if you want to do something, then set your mind to it and go out and do it, I guess.
Exactly.
Perfect. That's great. So thank you both so much for taking time off to come and speak to us. I know that you were both meant to be having some downtime today, so really appreciate it. And I'm sure the listeners have found that very useful. So thank you.
Thank you for having us.
Thank you.
We hope you have enjoyed listening to this episode. We would love to hear your suggestions for future guests. Remember to follow us on social media using hashtag the Eastman Dental Podcast. And if you like what you hear, please like, share, subscribe, and listen out for future episodes.